It was absolutely horrific and unimaginable.
Dr. Raul Kurane, the president of the Minnesota Hospital Association, says yesterday's shooting left many in the healthcare industry shocked and on edge. According to OSHA, workers in hospitals, nursing homes, and other healthcare settings face higher risk of workplace violence.
What we do in our clinics, in our hospitals, in our healthcare sites is to prepare.
With violence against healthcare staff increasing in recent years, with the COVID-19 pandemic maximizing it further, security expert Richard Sem says smaller clinics may be most at risk.
Clinics, because they're smaller, they don't necessarily have the same resources like security staff that you might see at a larger hospital. So they have their own challenges.
Back in 2019, North Memorial Hospital was placed on lockdown after dozens of people started fighting. Most recently, in October, Hennepin County Medical Center was temporarily shut down after a bullet hit the window near the emergency department. The Minnesota Nurses Association issued a statement in response to the shooting, saying they were shocked and saddened. The organization went on to say, when nurses reflect on the increase of violence in the healthcare setting, tragic incidents such as the one at St. John's Hospital in 2015 plague their thoughts. While Karani says nurses and healthcare specialists have been working day and night during the pandemic, he hopes the industry can learn from this latest tragedy.
We will heal from this.
The Nurses Association is now calling on policymakers to make those changes to help keep workers safe. Back to you.
All right. Thank you, Charmaine. Stay connected to KARE 11 right here and online as this story continues to unfold, as charges could come down soon against the suspected gunman.